So good afternoon, everybody, and welcome to Mission Hospice's Caregiving 101 talk with Christina Irving from the Family Caregiver Alliance. We're so grateful to have Christina with us. Christina and the Family Caregiver Alliance have been community partners of Mission Hospice since we started our community education program in 2015. And for those of you who have attended some of our advanced care planning events or have used our Take Charge materials, Christina and Family Caregiver Alliance is one of the several groups that were instrumental in putting that material together and providing that as a training that we offer to our community. So, Christina, I'm so grateful to have you. I want to say just to those of you who are joining us, a couple of words about Mission Hospice for those that are not familiar with us. We are small, not-for-profit and non-affiliated, meaning we're not associated with any large hospital or home care system or healthcare system. We're located in San Mateo County, which is the county between San Francisco and San Jose. So we serve a very diverse community of people, from migrant farm workers out on our coast to Silicon Valley executives who live all over the area that we serve. So a very diverse group that we serve. And also we've been doing this work for 42 years. We were founded by two women in our community, one of whom became our first patient in 1979. She knew there was a better way to die than in a hospital where she was at the end of the hall. And through her work, she was connected with another person, Helen LeGren. So Mac Nash became our first patient. She died in 1979. Helen, our second founder, died in 2014 at the age of 103 years old. She had seen thousands of people affected by the work that she and Mac Nash did. And we continue to be just so grateful to her, both of those women. So welcome. Our community education program has been going pretty strong since 2015. And during this pandemic, we have had an opportunity to move it from our local community to an online platform where our local community still joins us. And we also host people now from all over the country and often from other parts of the world. And it would be wonderful if you were able to put up in the chat where it is you're zooming in from today and what, if any, caregiving questions you may have. Christina, we talked earlier, and she would appreciate if people have questions as she's speaking. You're welcome to put up your hand, and the way you do that in Zoom is to move your cursor to the top or bottom of your screen, and you'll see a place that says reactions if you have the most recent version of Zoom. If you click on that, you'll see some hands and crying across the top and a heart. At the bottom, it says raise hand, and when you do that, it signals to me that you would like to ask a question. It also orders people in the order that they have put their hands up. So it orders, the order that you put your hand up is the order that you appear on the list that I see to call on you. So I appreciate people doing that. I can't see if you just raise your hand like this. We can't see that you've raised your hand because we're just looking at a small part of the larger screen. So thank you, everybody. I think we've gotten through all the preliminaries. Also, if you want to just put a question up in the chat is located also at the bottom or top of your screen. And if you just type in there and preface it with question, then I'll know that you have a question. And when it's time for the Q&A portion, then Christina and I will be able to move through that pretty quickly. And Jennifer, I did not realize you also live in Alameda, which is where I live. So welcome, welcome, everybody. And I'm going to spotlight Christina Irving right now, so that we can all see her. Christina, thank you so much. One of the reasons, this is sort of one of the first times we've done a themed month here at Mission Hospice. And the theme is caregiving. And in part that's happening because in February, March, and part of April, a friend of mine had asked me to be her power of attorney, and she was a well-known person in the end-of-life community here in San Francisco, the Bay Area, Irene Smith, and she wanted to die at home she didn't have family. She wanted us to put together a caregiving team of volunteers that she had trained and friends and all sorts of folks that we were putting onto a calendar, and we scheduled caregivers for 9 weeks, 24/7. And I have to say, it was one of the most extreme sports that I have ever participated in. Everybody was exhausted spiritually, emotionally, physically. And we were, I would say about this group, some of the most trained and end-of-life people in the Bay Area. People from the Zen Hospice Caregiving Project, some of our volunteers assisted people who'd worked in the AIDS unit in the early 80s at San Francisco General, and yet we were exhausted by this experience of caregiving. And so this month we're dedicating to Irene Smith and to caregivers around the country. And Christina, I just would like for you to introduce yourself for a minute. I do have some polls, and I don't know if you'd be interested in this. I have polls asking people if they've ever been a caregiver to somebody that's ill, they've ever been a caregiver to somebody who has died, and if they anticipate being a caregiver in the next 5 years. And Tom is also asking, what is that scene behind you? And I have to guess not me, because it's a window with a tree, but maybe you could say something about the scene behind you. And after your introduction, we'll put up the poll. So thank you.
Sure. I was actually just about to try and write that back. So behind me, this is actually a scene from Alaska, from a trip about 3 or 4 years ago. And after a year of looking at a lot of the same 4 walls as we've been doing, I at least will use a virtual background to make something a little bit more interesting and hopefully enjoyable than the walls we've all been staring at. So yes, really happy to be here with everybody today and to join you all and to be able to talk about caregiving. I'm a licensed clinical social worker with Family Caregiver Alliance. We are a nonprofit that's been around for about 40 years in the San Francisco Bay Area to really serve and support family caregivers. So we provide direct services to the 6 counties in the San Francisco Bay Area, and then do provide education and some referral to caregivers across the country and helping connect caregivers with resources where they live. So we have a little bit of a split of more intensive direct services locally, and then some additional services nationally. And I know we've got people coming in from all over the place. So hopefully a lot of what we'll talk about today will be useful for everybody. And then if there are specific questions about what the services look like where you live, I will try and give you some guidance. And I told Susan I will share the PowerPoint to have that get sent out to everybody afterwards. And if there are some other kind of common referrals or resources that would be helpful, I will share that as well, so it can be sent to everybody who joins today. So that's kind of a brief overview. If you want to launch those polls, Susan, that would be great. And then we'll kind of get into more of the meat of our conversation today.
So this is just so we can see how people are, what people's experience is with caregiving. So you should see a poll. I'm going to launch the polling right now. There's just 3 questions. What's really lovely is we get to see, this is anonymous. Please know we have no idea who's answering these questions. But if you would just note if you have ever cared for somebody as they recovered from an illness or surgery. Have you ever been a caregiver to someone who died? And if you anticipate being a caregiver in the next 5 years, and we give, there's 13, 14, good, we're getting close. And I know there might be people that are on a phone that would make it a little more difficult for them. No, everybody should be able to respond to the poll. So we're going to just give it a little bit more. Thank you so much, everybody. This is really helpful also because it can help Christina, kind of steer the conversation. And we have all but 2 people who have done this part. So I think, and that may be because, yes. Okay, great. So Christina, can you see the poll?
I do, yeah. So it looks like most have cared for somebody, and actually many who have cared for somebody who has died, and 79% say they anticipate being a caregiver in the next 5 years. So might be a mix of some people who have been a caregiver or are currently caregiving, or maybe planning ahead for when you will be in this role. So you are in the right place.
Yes.
Okay. Let me go ahead and end. Okay. Right. Actually, we'll do a quick share of the results so you can all see. Yeah, and caregiving does touch so many people. As Susan just described her recent experience, more and more we're seeing so many people who are in a caregiving role, and we've actually seen that increase with COVID, that people stepped into caregiving in a way that they maybe hadn't anticipated before, because they were trying to make sure that someone stayed safe, that they were in a position to provide some help. So my plan today is I'm going to walk through a bit of a presentation. Again, if you have questions, comments, or something you want to add, feel free to put it in the chat. We'll keep an eye on it. Or if you want to raise your hand when we're in a good stopping place, we'll allow people to share as well while we go. So with that, I'm going to share my screen with everybody. Okay. So again, this is really meant to be a good kind of overview of what does it mean to be a caregiver? How do we take care of ourselves and find the support and resources when you're in this caregiving role? Because it can be challenging. There can be some wonderful experiences that people have as caregivers, but it can also be very difficult at times. So hopefully this will give you some thoughts on next steps and support for you in this caregiving role that you may be in now or might be in soon. So when we're talking about it, I just want to set some context to what we mean when we say caregivers. And we're really talking about the family, the friends who are providing care to somebody. It might be in the home with them. You might be living with the person you're caring for. They might be living across town. They might be living across the country. And it doesn't mean that you're not still caregiving for them. And it comes in so many shapes and forms when you're caregiving. And just to kind of give some bigger context to it, in the US right now, there's 53 million people who are in some sort of caregiving role. And the most recent numbers on the value are from a few years ago, so the number would actually probably be higher, is that if all the caregivers said, not doing it, we need to have paid care instead, that value is worth $470 billion. So there is an amazing value that family, friend, caregivers provide to individuals, but really to our society as a whole. So there is tremendous kind of value and worth in what you do. And sometimes when you're in it, and if it's a day that's not feeling so good, it can be hard to remember that. And we see a growing number of people who are caring for someone with dementia, whether that's due to Alzheimer's or some other condition. It's a kind of segment of the caregiving population that often gets called out because it can have some of its own challenges, as many types of caregiving do. But again, it's a number that we've seen kind of grow over the years. So huge kind of value that caregivers do. And just that realization that you're not alone in this role, that there's 53 million people who are doing it. And while everyone's caregiving situation may be a little different, slightly different scenarios, there's a lot of commonality across caregivers. And it can be so helpful for caregivers to connect with each other, because you can learn so much from what other people have tried, what's worked for them or what didn't work for them. And that can be a great value to family caregivers. So kind of what do caregivers do? Again, it's a huge range. Most are helping with some sort of daily care. And that could be things like going to the grocery store, helping with medications, managing finances, up to things like personal care, helping somebody take a shower or use the bathroom, helping them get dressed. But more and more, we've identified that caregivers are also helping with medical tasks. So medications, maybe monitoring for blood sugar for someone who's diabetic and giving insulin injections, maybe somebody who needs to be on oxygen, or they have some sort of wound that needs wound care. Maybe they are using specific medical devices like CPAP machines or something else. So more and more caregivers are doing these medical tasks. And the challenge with that is a lot of times families aren't getting trained on these things. So you might be doing a lot of care that nurses, CNAs, LVNs, the people who go to school for this do, but not necessarily with the same training. And a lot of times people don't always recognize that they're a caregiver. So this is a campaign, it's a little hard to see on a Zoom screen, but initially came out of the Wilder Foundation in Minnesota. And it's kind of like, we call it caregiving, because people don't always recognize that they are in a caregiving role. They think, well, this is just what you do. This is what you do for a spouse or a partner or a parent. I just need to take them to the doctor. I need to help make sure they take their medications or pay their bills, and not realizing that over time, that really adds up, all of those responsibilities and those roles that you're in. And that recognition of, I'm not just in the same relationship that I've been before. This is not just a parent and I'm their child, or a sibling. I'm now also their caregiver, because it changes the dynamics within the person that we're caring for. And it changes some of who we are, because our role is very different. And just being able to say, I'm a caregiver, okay, what are the supports and resources available for me, can be really helpful. So not everyone identifies in this role of caregiving. It's just, this is family, this is what we do. But it is a different role and different responsibilities that you end up taking on. Because of COVID, I'm like, I can't not talk about what that impact has been. We know that caregiving can have an impact on health, on stress, on mental health of caregivers. And a couple of the larger surveys that were done over this last year really showed, not surprisingly, that there was a huge impact on stress for caregivers during COVID. And that's definitely a lot of what we heard. Some of it was around financial stress, caregivers who had lost jobs, or just things were costing more than they had before, suddenly needing to pay for delivery, and what those expenses were versus when you would actually go to the store safely. Obviously, the worry and the fear about catching COVID and the safety around that. We heard from many caregivers about, I don't want them to go out as much. I don't want them to go to the grocery store. I don't want to have other people in place. And so that balance of kind of risk and safety, and that was a huge worry for people. We heard both for the caregiver and the person they're caring for that they were having fewer visits with healthcare, to the point that we had one client early on, and this was really pretty early on in the pandemic. Her mom had a fall, and she called the doctor and said, should I take her to the ER? Because there was so much concern about just the number of people with COVID coming into the hospital system. And the doctor said, I wouldn't right now. I would just kind of keep an eye on her and watch for these things. And that pressure on that caregiver to say, okay, I'm making the decision about whether she's okay or not. Yes. I don't have anybody else kind of evaluating that. That's a lot of pressure we hear throughout the year outside of COVID, but it definitely has increased. Again, that sense of being in this medical role of being responsible for somebody's well-being, and are they okay? And then just fewer supports, and this can be both formal and informal. So formal supports of like using community resources, and then just family and friends. And unfortunately, this isolation is really common in caregivers, but with COVID, it definitely increased, and we saw it so much more of an issue. And so as we hopefully are coming out of COVID, we want to make sure that we're reconnecting with people and getting that support that you need as a caregiver. So I want to touch on isolation a little bit, because again, this is something that we're seeing in higher numbers amongst our clients. That 86% have reported feelings of isolation or loneliness as a caregiver pre-COVID. So we know these numbers probably went up a little bit over the last year. And some of it can come from feeling abandoned by family or friends, people not stepping up to help out and provide support. And often the feeling is, well, you've got it, you're taking care of it, so I'm going to step away and I don't need to be involved. And sometimes it's friends not calling because they feel like, well, you can't meet up anyway. You're not able to connect. You're not able to come out. So what should I even keep calling? So we definitely see this loss of relationships when you're really in that day-to-day caregiving role. And what comes with that sometimes is not knowing, how do I get help? How do I ask for it? Who do I call? And then the family dynamics, when there's different opinions about how care should be provided, who should be doing what, a different understanding of what the needs are. So all of these really contribute to just a loss of some of these social supports in our life. And so some of what we'll talk about today is how do we kind of deal with this isolation? What are the things that we can do that provide more support and connection for you as a caregiver? Sometimes the feeling is nobody else is going to get it. They're not going to understand what I'm going through. And yet there can be ways, and it can be so valuable to have additional support, because they're finding in research that loneliness and isolation actually have similar health effects as smoking cigarettes, as a number of other kind of activities that we know are not so good. They're finding that isolation and loneliness can actually have negative physical health effects as well. So knowing that caregivers are at higher risk, we want to figure out, how do we deal with this? How do we get kind of those supports around it? Another really common emotional experience for caregivers, and definitely over this last year, is grief and loss. And I don't know if anyone wants to share just in the chat even what are some of the losses that they've experienced just in their role of caregiver. Sometimes it's the anticipatory losses, the things that you expect to come because you're seeing somebody's health decline. You're seeing those changes over time. Sometimes the losses are about you. Might be losses of those friends or relationships, things that you used to do and enjoy that you feel like you don't have time for anymore. And then there's this term called ambiguous loss. The idea of someone being there but not there, of something has changed but it's still the same. So when you're caregiving for somebody who has a serious illness or a chronic condition, they're still there, they're still with you. They might be sitting right next to you, or they're in the other room, but it's not the same as it used to be. They may not have the same memories, the same experiences, be able to do the same things that they used to do. And so there's those losses. It might be that you had shared responsibilities. So for couples, sometimes the sense of, well, I dealt with paying the bills and they dealt with, taking out the trash and doing the laundry. And now maybe they can't do those same things. So you've lost that partner in chores. Sometimes it's that person who you can kind of talk about your day with, because they might not be able to have those same conversations in the same way. But it's, how do we also focus on what's still there? So we grieve the parts that are lost, and how do we hold on to the parts that we still have? And that can be a really hard experience to articulate for people, because again, this person hasn't died, they're still with me, and yet our relationship isn't the same as it used to be. Who they are isn't the same. And so people who aren't caregivers often don't understand that, can't always understand that you are grieving, that there are these losses that you're experiencing. And so it's this balance of, how do we acknowledge and grieve for the things that we've lost and hold on to what we still have? Do they still have a sense of humor? Do we still enjoy the same movies or music? Are there parts about me that are still important to me that I still have in my life? But we need to acknowledge that. We don't have great rituals around loss when you're a caregiver. We have rituals around loss when people have died. We're not so good about losses when people are still alive, but our lives have very much changed. So just being able to acknowledge them and say, this isn't what it used to be. This is not maybe what I expected my life to be like. How do I still find the value and purpose in it? The other big emotion around caregiving that we can't not talk about, because it is such a huge one, is feelings of guilt. This is probably the most common thing we hear from caregivers, all the feelings of, I should do this. I should be able to do it all. I should be able to take care of them. I should be able to stop them from going outside when there's COVID and there's risk, or for somebody who has dementia might get lost. I should be more patient. I shouldn't have yelled or gotten angry or frustrated. I should be able to visit more when it's somebody who's at a distance. So there's lots of feelings that caregivers think, I should be able to, I'm a caregiver. I should be able to do this. This is what this means. And that puts a lot of weight and responsibility on caregivers, because it assumes that you have control over all of that. And so while this doesn't get rid of feelings of guilt, we actually want to take a step back sometime and try and differentiate between guilt and regret. Guilt is, I've done something wrong. I've done something to harm or offend or hurt another person, and I took these actions to do it. So it can be actually a healthy feeling because it says I need to make amends, I need to apologize, I need to figure out what do I want to do differently next time so that I don't have this same feeling, so that I don't do something to hurt or harm another person. But regret is defined as the sorrow we feel about circumstances outside of our control. So I regret that person I'm caring for can't be 100% independent anymore and they need help, maybe with personal care. And I regret that I am not capable of doing it all the time without being burned out and overwhelmed myself, which means we need to bring in outside care. And it might be that that other person doesn't want that. I don't want that, I don't need it, and they can be very upset, and caregivers might feel guilty that I'm not doing what they would want. But are we working within the circumstances that are in front of us? And it may be circumstances that we can't control. I had a client who was caring for her mom and her brother was not involved. He didn't visit very often. He really wasn't stepping up. And she's like, I feel so bad. Like I should be able to engage him and get him to help. You know, I know my mom misses him and she doesn't like seeing him not there. And it's like, you cannot control his behavior. So can you feel regret? Can you feel sorrow that that is the circumstances that he is not showing up? Yes. Is that something within your control to change? No. So as caregivers, being able to think about what are the things I'm feeling bad about, how much of that are things that I can control and how much of it are things that are just, sometimes these are really crappy circumstances. And this is not how we wanted things to go. And even with making decisions sometimes, again, bringing in in-home help, maybe even using a care facility or, having to kind of have somebody go into the hospital for a period of time. Sometimes those decisions we have to make, even when they feel hard, they're not decisions we want to make and they feel kind of yucky, doesn't always mean that they're wrong. But they're the best decisions you can make given the reality of our circumstances. And so is that something I need to feel guilty about? Or is it just something that is really hard to go through? So this is where, again, talking to other caregivers, having support can be so helpful because it's really hard for us to do this ourselves. But it can be so helpful for somebody else who's kind of walked the same path to be able to say, no, that was the best decision you could have made with what you knew. That was the best you could do given what your circumstances are. And it can help let go of a little bit of that guilt that sometimes will weigh us down. There's a wonderful poet. She was a caregiver for her mom with dementia. And this was a poem from a little over a year ago, I guess now. And so when I send this out, I really encourage you to look at the whole thing. But it was a poem called Imperfections. And at the end of it, she says, we are caregivers, perfect in our imperfections. We are not going to be perfect. There is no such thing as a perfect caregiver. It's not going to work. We're not going to be able to do everything correctly. But that perfection of I'm here, I'm doing the best I can with what our reality is and what our circumstances are. And sometimes that means it's, I'm going to either look back and say, I wish I would have done something different, knowing what I know now can happen. Or just realizing there are times that, we're maybe going to be a little bit more irritable than we would like to be. But that doesn't take away kind of that value and that worth that you bring in a caregiving role. So just that sense that we are perfect in those imperfections because you're showing up and you're there. So when we talk about kind of support and resources for caregivers, I want to come at it from this perspective of resilience. Resilience doesn't mean that things aren't still hard, but it's that process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. That's definitely what this last year has been like, I think, for most everybody. But for caregivers, this is true most of the time, is that there are these significant sources of stress and adversity. There may be trauma or tragedy as well. And so again, it doesn't mean that these things aren't still hard and difficult, but it's how well do we adapt to it? How well do we recover from it versus kind of just being kicked down and kicked back all the time? So often it's this idea of, if you have a glass and you're constantly pouring out a little bit of that water, a little bit of that energy to somebody else, we need things that that refill that glass, that refill our personal energy, so we're not kind of constantly drained and burned out. And that's that part of, how do we adapt well? How do we move forward from it? So I'm going to talk about kind of these pieces of it, about, healthy thoughts and purpose and connection, again, because of that high rate of isolation. How do we seek help? What do those resources look like? And what does it mean to kind of build up our own wellness? Anxious thoughts are really common for caregivers. And so thinking about how our thoughts are helpful or less helpful for us. So this goes back to the guilt of, thinking in the I should be able to get it all done. I should never get angry or frustrated. Nothing is going right. There's no help for me. And to think about, is that true all the time? Probably not. Are there times it is? Maybe. But so being able to really look at our thoughts and say, is this something that's helpful for me? If it things like, I should never get frustrated. I should always be able to be patient. It's like, well, is that realistic? No. Are there times that I do? Yes. Okay, what is that telling me? Maybe that's saying I need a break. I need to be able to talk to somebody. I need to get some more help. Okay, that's a helpful thought. But if we just leave it as, I should never get impatient, or I'm always irritable and frustrated, that's not so helpful for us. It tends to make us more anxious and feel more helpless and powerless. So we want to focus on, what are the things that I can control? What are the things that I need? And that can help manage the anxiety if we can focus on those elements that we can control and what we can do that is helpful for us as a caregiver. This was an article that came out early on in COVID, actually, from somebody who has done some work with Elizabeth Kubler-Ross, and he was talking about kind of the grief that we've experienced throughout COVID, and looking at kind of those stages of grief and loss. And he said, as acceptance, as you might imagine, is where the power lies. We find control in acceptance. I can wash my hands, I can keep a safe distance, I can learn how to work virtually. So those were the things around COVID. But for caregivers, can it be, I can ask for more help, I can learn about community resources, I can find ways to get some breaks, I can do something that helps me relax and de-stress. But to do that, we have to accept kind of what our current reality is, that maybe we can't do it all, or that somebody is needing a lot of help. Maybe that it's more than we can personally do. So being able to look at our thoughts, how are we thinking about our situation, and what are the things that we can control that will make a difference? What are the things that we can do that can help? One of the other pieces, especially when we're looking at how difficult caregiving can be, is to find that balance of what's the purpose or the meaning that comes with caregiving. About half of caregivers will experience symptoms of clinical depression at some point during their caregiving journey. So that's a pretty high rate. And often that comes from, again, these feelings of helplessness and sadness about our situation, which are very real and understandable. And so how do we balance those losses, those things that are hard, with what we've gained? So if people can share in the chat, what's one positive thing that's come out of caregiving? Or what's one thing you value about caregiving? Anyone wants to add anything in the chat? One good thing that's come out of caregiving, whether you're doing it now or you did it in the past.
Thank
Valuing
you.
life.
Anybody else who's been a caregiver want to put up something that they took away from that experience that might be unexpected, or a discovery, or just really difficult?
Yeah, those moments of intimacy, acceptance of the what is, which is not easy to do. growing closer to the person you're caring for, that closer bond with them. Oh. Thank you all for sharing those, and those positive aspects of caregiving. And thank you, Susan, being able to provide what somebody wanted at the end of their life. Those positive pieces of caregiving, they don't take away from the things that were hard. It's this perspective of, it doesn't mean we're just going to think positive, that we're not going to focus on any of the negative things. We can acknowledge those. We need to address them. Again, we need to grieve those losses. But to be able to then recognize that there is another side to this. And that even just if it's moments, even if you can't do it every day, to have those moments when you can say, it expanded my sense of compassion. I don't have regrets. Felt like a sense of purpose in working with the medical team. Yeah, being able to watch those changes that take place. To be able to have those moments when you can acknowledge the purpose or meaning or positive parts of caregiving, help provide a balance for the things that are hard. So again, this is that idea of that ambiguous loss. There's things that's there that and not there. There's losses. There's really hard and sad parts of caregiving. And then here are the things that are positive and that have given us meaning. So sometimes it is, I was there to take care of them. The skills that people learned in advocacy within the medical system, maybe with being able to provide certain medical tasks or care, or that relationship with the person. When we have those times where we can focus on those positive, it helps kind of manage and mitigate the negative. Again, doesn't mean they go away, but we're talking about building resilience. We're not saying we're not going to be bothered by the things that are hard, but we're saying we're finding those things that are going to help us recover back. So how do we find that purpose? Again, identify that. And then it's really important to build connections as a caregiver. Again, isolation, loneliness, such huge issues. And so we want to look at, are there ways to engage family and friends? This is not easy, and it's definitely not always possible. You can have the best communication in the world with the people in your life, does not mean that they will always step up. There are times that they won't. But we want to try to engage where we can. So how do we talk with family and friends and let them know what we need? And this is sometimes the really hard part, because there's this feeling that they should get it. They should understand what I'm going through. They should understand why I need more help. They should understand why I can't do this all on my own. And unfortunately, not everybody gets that if they haven't met a caregiver. So it often does fall on us to be able to really clearly articulate what we need. You know, it might be having to say to somebody else in your family, I need somebody to come over on Friday so that I can get out of the house for a couple of hours because I'm feeling very overwhelmed. Is everyone going to hear that? No. Will some? We might. And so at least can we try to engage them? And sometimes it's the help for the person we're caring for. Sometimes it's the help for ourselves. I need somebody just to talk to. You know, so some caregivers will tell friends, you know what, I don't necessarily need advice. I just need to be able to call and maybe vent for a little bit. And then we can move on to other conversations. Or to say, you know, I'm not always going to be able to come out, but I still really appreciate you calling. And I don't want you to stop calling. I still want you to connect. I just may not always be able to respond in the same way. There are some helpful websites and apps that try and facilitate coordination amongst multiple people. So they might be ways that you can create a shared calendar and say, this is when the doctor's appointments are. These are when things are happening. Who can sign up and who can volunteer to do it or to bring by meals. So lots of helping hands, caring bridge. Those are two that have been around for a really long time and can be really helpful in being able to kind of share tasks and responsibilities with people. So worth, again, doing that, because sometimes people are more likely to continue doing the tasks that they feel more comfortable with. If you're caring for somebody who requires a lot of personal care, again, you've had to do it, you've learned because you've been in that role, you kind of just had to step in and do it. Somebody who's not in it day in, day may not feel as comfortable doing that, but they might be the person who would bring by a meal, who might make the calls to community resources to find out about supports. Maybe they're the ones who will help with the paperwork or come and do yard work for you. So think about, what are those things that you need help with? It is possible to do family meetings. Many social workers, therapists, sometimes even kind of faith leaders will lead that, to be able to help facilitate those conversations when there are maybe multiple family members involved who are not quite stepping up the way you need to, or when there's some conflict. So worth thinking about if that's what you need. Caregiver support groups can be a great way to actually get support from people, again, who are living through it, who understand what those roles are like, who know what resources are available. I don't think we've had many in-person groups kind of come back yet, but there are a number of groups online now. So most of them kind of via Zoom, like what we're doing today. Others that are discussion boards where people will just post comments and share feedback with each other. And so I really encourage people, if you've never connected with a caregiver support group, to try that. And then sometimes you might just want to join some other sort of class or activity that's not about caregiving, but just gives you, again, a chance to connect about something else that's important to you and important to in your life. And again, many of these are still happening online, hopefully again in person at some point. But to connect with your local kind of community center or senior centers, because there's a lot of great kind of classes and activities that may not be caregiver focused, but give you a chance to kind of have those connections and those relationships, things that were important to you before. So how, again, do we kind of stay busy, stay connected? And this is also things that might be helpful for the person that you're caring for, because sometimes that's one of the harder challenges for caregivers is, how do I keep them busy? How do I find things that are good for them to do? Well Connected is a fantastic telephone and kind of online activity group for older adults. So it could be for the person you're caring for, it could be something you do. They have discussion groups and support groups and activities that they do all the time on all sorts of different topics and activities. If you are caring for someone with dementia, the Alzheimer's store, it is a store online, and sometimes it can just help generate ideas of what are things that I can use to keep somebody with dementia engaged, to help make sure they stay safe, but ways that they can kind of stay busy and active together. Time slips is one example of kind of a creative engagement. So how to use creativity to do things with the person that you're caring for, so that it's something that you can do that is meaningful together in a creative way. And then always take a look at whether there's friendly visitor programs, right now more by phone, but sometimes in person. And different counties will have those where it's somebody else who can come in, maybe for a visit with the care recipient. It might be for a visit with you. So in San Mateo County, there actually is a senior peer counseling program. So it's a program that provides informal supportive counseling to older adults by other older adults. So it might be, again, a person you're caring for who could use somebody else to connect with and talk to. It might be for you as a caregiver to be able to have that one-on-one person that you can connect with. And then again, I mentioned Caring Bridge is a great way to try and engage family members or friends in care, kind of keep them updated and aware of what's going on. And then one of the kind of more positive outcomes of Zoom is how much is available online around kind of virtual tours and museums and, things that can be helpful for somebody to engage in that might give you something that you can do with them, or something that they can do on their own. So when we're talking about, again, kind of building resilience, being proactive, what are the things that I can do? So a couple of the tasks that are really important for people to think about when you're caregiving are, what are the documentation that I need to have in place? So looking at legal documents, so advanced healthcare directives. Susan mentioned some of the education programs that Mission does that we've done in partnership with them, which has all been around advanced care planning, but really important for the person you're caring for to have an advanced healthcare directive, really important for you as the caregiver to have one. And these are the documents that says, if I can't speak for myself, who's going to make my medical decisions for me, and what do I want or not want? So really good to have. You want to make sure you have it in place, that you have a backup person, that you know where the documents are. But this can be a useful way to feel like you're taking charge and taking action on the types of planning that is going to be helpful for you if there's a hospitalization or if the person is not able to make their own decisions. And this is also a question that comes up from a lot of caregivers, and this came up a lot more during COVID is, well, what if something happens to me? Who's going to step in and take care of them? Who's going to take care of me? So having this documentation in place kind of gives that backup. The POLST form, or in some places it's called MOLST, which is the physician order for life-sustaining treatment, or the medical order for life-sustaining treatment. It's kind of a supplemental form for an advanced healthcare directive. So for people who have a really serious illness, it is a physician order. It's something you do with your medical provider. But again, it refers to specific treatments that you might want or not want. And so especially when we went through this year of not being able to easily visit people in the hospital, this is really helpful to have and really necessary to have. Personal health records, also really useful. And again, I think especially during COVID, we saw a need for this even more. Do you have in one place what medications they're on, who the doctor is, major information about health or allergies? It might be a notebook or a binder, could be a folder. It might be an app, or a secure website where you're keeping track of all of this information. But that way, if there is an emergency, if there is a crisis, you have all this readily available. So that anxiety about, did I forget something? Did I not mention this particular medication or supplement that they're on? Did I not mention, the surgery that they had before, or an allergy that they had? When you have it all in one place, it's going to help ease a little bit of that anxiety in those moments. And it's really useful when it's hard to go in and visit, if you know you've got it ready and it's always there with you anytime somebody goes to the hospital or to a doctor's appointment. This past year has really pushed us forward with telehealth visits, so kind of visits with doctors online. I don't think it's going to go away. There's some good and bad that comes with it. But if you haven't really used it, it's a good time to connect with it and engage, because you might find that for quick questions, it's going to be easier. And I think the one benefit more than the primary care and medical care is the mental health support. Again, about half of caregivers experience symptoms of depression at some point during their caregiving. But caregivers also don't have a lot of time. So getting out to see a counselor or a therapist might be really hard, but doing a visit by telehealth, by video, might be more doable. So it can be really worthwhile to think about telehealth as that support for you, not just about how you use it for the person you're caring for. When we're thinking about types of community resources and bringing in support, sometimes that balance is, do we take care of ourselves? Do I even need help versus bringing in outside help? And so we have to kind of balance that expectation of who provides care. And in some families, there's an expectation that it is the oldest child, the youngest child, the daughter, the one who's not working or who doesn't have kids. But being able to kind of acknowledge that there are going to be certain expectations that may or may not be accurate. Sometimes it's that family size. Who actually is there that could step up? Is it going to be more friends because there isn't much of a family? Who has the availability or lives nearby? These are things that we need to kind of surface and talk about, because it's going to influence what resources and supports we might connect with. And then there can be a lot of stigma about accepting outside help. In some cultures, in some families, you don't do that. You need to be able to take care of your family, and you don't bring in outside people to do it. Or even just the stigma of acknowledging a need for help, that we are not completely self-sufficient and independent. So they're hard conversations to have, but it's really important. And so sometimes what it means is, as a caregiver, you might start by reaching out for help and support for you, rather than just for the person that you're caring for. They may not be ready to accept that help. There might be, again, a lot of stigma around bringing in outside help, but it doesn't mean that you can't get that support for yourself as a caregiver. So a little bit, this is a whole topic in and of itself, but I'm going to at least try and succinctly as possible talk a little bit about kind of how to pay for care as we talk about community resources. Medicare is generally not going to pay for ongoing care. They pay for kind of acute, short-term care that somebody needs, a hospital visit, a doctor's appointment, but long-term care is generally not going to be covered by Medicare. So most people end up paying privately unless they qualify for Medi-Cal, which has very specific income and asset limits, and they're way more complicated than we're going to be able to really get into in a presentation right now. For spouses where one individual is needing Medi-Cal for really more serious kind of care, they kind of meet that level of being cared for in a skilled nursing facility, but they could be cared for at home. There are actually some more flexible limits in terms of assets and income. So if you look at these numbers and say, oh, no, we're above that, we can't qualify, but this person really needs a lot of care, a lot of personal care, a lot of in-home care, there might be some flexibility with it, but it really depends on, as a couple, your income and assets. So I'm happy to share more specific information, but it's a complicated system to try and navigate around Medi-Cal. So I really encourage people to talk with a social worker, a senior legal program, if it's something that you're looking at. Not many people have long-term care insurance. If you do have it, though, you really want to look into what's covered and what the eligibility periods are, because those vary so much plan by plan. And if you're caring for someone who's a veteran or the spouse of a veteran, again, really important to connect to the VA. So this is the part we want to be proactive. We want to plan ahead for these things, figure out what coverage do we have, what might be available for us, because that helps you plan a little bit more, not waiting until there's a crisis and you really need help to explore what these options are. These are the things you want to be looking into ahead of time. And along with that is those community resources. So how do we seek help in a really proactive way about getting support and connection to people? In a crisis moment, every county is going to have an adult protective services. If you feel like somebody is kind of in danger or unsafe, they are always a resource to be able to reach out to. The Disaster Distress Helpline is something run by SAMHSA, the Substance Abuse and Mental Health Services Administration. So it's a federal program, and disaster includes pandemics. So it is kind of a crisis support line. If you're caring for someone who has some sort of dementia, the Alzheimer's Association is a 24-hour helpline. So if it's 3 a.m. and they're awake and things are difficult and you're having trouble and you just really need to talk to somebody, it's always a resource as well. And then the friendship line is kind of a crisis, emotional support, and suicide hotline specifically for older adults, inclusive of caregivers as well. And it's actually run out of the Institute on Aging in San Francisco. But it can be a great support because it's people who are trained really to understand the issues of aging and disability. In connecting with very specific kind of resources to know what type of home care is available and how do I find a caregiver support group, I know we've got people calling or coming in from all over the place. If you're within California, the Caregiver Resource Center system is a resource for you. Family Caregiver Alliance is the Bay Area Caregiver Resource Center, but anywhere in California that someone lives, there is a Caregiver Resource Center that provides support. In San Mateo County, Aging and Adult Services is your area agency on aging, and that is a great kind of initial contact for other community resources. If you live outside of California, wherever you live, there is an area agency on aging, and that is your entry point for services. That's the place that you would call to find out about what's available. In particular, to find out about the National Family Caregiver Support Program. It is a federal program. Every state has it. Exactly what it looks like is going to vary state by state and often county by county, but your local area agency on aging will have that information. And when we wrap up, I'll do a quick search and I'll stick a number in the chat for people that will get them started on locating their local area agency on aging. But that's where you would want to start for local community resources. So the types of things to think about in terms of respite, and respite just means to get a break. And really, I encourage people, don't wait until you're overwhelmed and burned out. This is, again, it's about seeking help. It's about being proactive. You want to look into these things, even if you're at a point where you still feel like, well, I can kind of mostly manage it. We're doing okay. This is the time to start looking at doing it. And it might mean from family and friends, but it might also mean that you're hiring in-home help. Could be through a home care agency, or it could be someone you hire privately on your own. And there's pros and cons to both, what the costs are, kind of the liability and the process. So things you really want to think about, what would that look like for us in terms of bringing in-home help? If somebody qualifies for Medi-Cal or Medicaid outside of California, there are programs that provide in-home care for people who are on Medicaid. Same with people who are veterans. There are some programs through the VA. And then there are these short-term respite grants. So again, California, we have them, but other states under this National Family Caregiver Support Program, there are respite funds that may be available to help pay for help to give you some time off. Out of home respite, so rather than just people kind of coming into your home, adult day programs are a fantastic model to give people more stimulation, more socialization and exercise during the day. There's social models, and then there's adult day health models for people who have more health needs, who need like a nurse for oversight. But they're places that people might go to, sometimes just a couple days a week, sometimes 5 days a week. But again, gets people out of the house, gives the caregiver a break, but gives people more exercise and activity. And then if you really need a break, or as a caregiver, if your own health is such that you need to take a little bit of time off, you need to get away, or sometimes for caregivers, when they need surgery or a medical condition, it is often possible to have someone go stay in an assisted living, a memory care unit, a boarding care home for a short period of time. It might be for a few days, might be a week or 2 weeks, but people often think of those as just kind of long-term care and a permanent move. Sometimes it can be helpful. You as the caregiver need to deal with your own health, or you need to go see other family and get away for a little bit. This can be a way to get a break as well. So that's another option for you. And then really thinking about, what are those things that kind of help foster wellness and that I enjoy in my life? What are the things that give me joy, are nurturing? And for caregivers where you don't have a whole lot of time, it's what are things that I can do in little small chunks that I can build into my life in a way that is realistic, but again, that help build up kind of my resilience, doesn't take away the things that are hard, but gives me a break from the things that are hard. So if people want to share in the chat, what's one thing that they've done or that they do that helps them de-stress, that helps them feel a little bit better? Something that they really enjoy? swimming in a warm pool. I love how specific that is, because yes, the cold pool, that just might add some of the stress, but swimming in a nice warm pool. That's great. What else do people do? What helps you kind of relax in even just a couple minutes? Spending time outdoors. Yeah, even just sitting outdoors. Silence. Running and walking. Pets and animals. Yeah, those can be great. So these are things that's really important to figure out, how do I build that into my life? And especially as a caregiver, again, you don't have a lot of time. How do I build this into my life in a way that is realistic, that gives me these moments where I can kind of decompress, where you can let it go a little bit? What are these things that kind of foster wellness for us? We have a class that we do, and there's a number of people that are trained around the country to do this class. So if you're somewhere else, you might look to see if anyone's offering it there. It's called Powerful Tools for Caregivers. It's a 6-week evidence-based class for caregivers. And at the end of each class, we have people do an action plan. What's something you're going to do for yourself in the next week before the next class? And it's like, how often are you going to do it? When are you going to do it? How confident are you that you actually be able to do it? And sometimes people will say, I'm going to, go for a run for an hour 4 times. And it's like, really? If you can do it and you can fit the time in for it, fantastic, go for it. But then people will come back if they didn't and feel like, oh, I wasn't able to do it. It's how do, again, we build something that's realistic. Maybe all I can do is go sit outside. So in nature, in silence for 5 minutes, and that's all I can fit in. But if that's all you can do, if that's what gives you that relaxation and that decompression, then that's really important to do. Barbara, do you have I see your hand up. Do you want to unmute? And
I do. I'm sorry, I put my camera on. I've got eyelash in my eye. And my
that's okay. No problem. No pressure.
I just wanted to say it is very important to do for yourself. I took care of my parents for 5 years. And because my mom was on home dialysis, I did her dialysis. And I was the only one that knew how to do it. So I couldn't, she had it 5 days a week, 6 hours a day. And my kids, the ones that did live here at the time, they were too afraid to take care of her. And so I never got any respite care. And my mom, after she had her stroke, she was very angry at me. And we were very, very close until then, but she was very angry at me. So then I had, going to the beginning of this, I had the guilt and I had the regret because I was angry, and I was angry that I had to give up my job, and I was angry that I had to give up my house to move home. And I would do it 1,000 times over again. Don't get me wrong, I would. But I had that guilt and that anger, and I did try to vent to them, but they thought I was complaining about my mom, so they were angry at me. And I still have no relationship with most of my kids because of it, because they thought I was mean to grandma, and I probably was some days not nice, but she was very not nice either. So it's very important to try to get something for yourself, something you can do. Thank you.
Thank you so much for sharing that. I think that encapsulates so much of what we talked about. And yeah, that recognition that it is hard to get away. I mean, dialysis at home 5 days a week, yeah, that is not an easy thing to get help with then. And so figuring out, is there something I can do around that? Is there something that is still going to help me stay healthy, help my well-being in the midst of everything that is so hard? And I think what you said of, I was angry, but doesn't mean I still wasn't going to do it. I think that's so important to realize that sometimes What's difficult for us is that we have these really contradictory feelings to say, oh my God, I'm so angry. I wish I didn't have to do it. I wish this wasn't what my life is like. And yet there's no way I wouldn't have not done it. Of course I was going to step up. And it feels like, well, both those things can't be true. And it's like, yes, they can. We can absolutely say, I wish that I didn't have to do this. I wish that, hadn't had a stroke, that she wasn't on dialysis, that other family members would step up. Wish that wasn't true. And I'm resentful and frustrated about it and angry about it. And yet at the same time, I'm going to be here and I'm going to do the best I can with it. And yeah, some days means I might be a little cranky about it, but I'm still going to do it. And allowing ourselves to be that kind of complete of a person, that we sometimes are going to feel ways that don't seem like they match, because this is complicated and it's messy. And that one of those things doesn't negate the other. So thinking about, again, what are the short things that we can do to foster wellness as we end up? People mentioned getting outside in nature. There's been some research on what they call awe walks. It doesn't have to be in a setting like this, but just going outside and just looking at nature and just focusing on it. It's this idea of kind of like mindfulness, and just to be kind of acknowledging and recognizing and being in awe of things in your world. Might just be the flowers or a tree or what the sky looks like, but just in those moments of kind of recognizing something in nature kind of bigger than us actually is very helpful in relieving stress. And then one of the simplest things is just breathing. When we're stressed, we don't tend to take as deep breaths. We tend to breathe very shallowly. So there's all sorts of apps that are out there. But this is a site called De-Stress Monday. And it's just something as simple as breathing in and then out with the shapes. Because we can do this in 30 seconds from anywhere. So when you have that moment where you're getting a little more frustrated with the person you're caring for and you can't really get away from them right then, you've got to be with them and you're helping them. But can I take a few moments and just try and breathe? And will that decrease some of my stress in that moment? So I'm just going to kind of close out by just a little bit about what FCA does. So again, information referral, helping connect people with local resources. We have a national kind of family care navigator on our website that does help identify state-by-state resources wherever people live. Locally, we do more in-depth assessment and care planning, but we do education programs every month. We have webinars that anybody nationally can join. We had one last month on journaling. We have one this month that actually is the short documentary called Spark that follows or talks about kind of Robin Williams' diagnosis with Lewy body dementia. So we have those every month that anyone anywhere can join. Support kind of programs. We have a lot of online programs and a ton of fact sheets on articles like hiring in-home help, understanding dementia behaviors, self-care, and specific diseases. So those are always available online at any time for people to download. And all of the webinars are always saved. So information, again, that can be accessed anywhere by anybody. We do also have something called Carenav, which is a portal for caregivers to get some individual information tailored to them based on what your current situation is and what you're looking for. So if you say, this is the type of help I'm needing and this is what our situation is, kind of by answering some questions, it will tag certain resources for you. So just a quick kind of snapshot of what it looks like as it pulls together information for people depending on what their needs are. So on our website, available at any time for people, and it's all free. So just a resource for people to find some of their local information as well as specific content if that would be helpful for them. And that's our info. And so I want to take kind of the rest of the time we have to be able to answer any more specific questions. And if there's resources or information that you want to share that you found really helpful that you think others would, that may be a great place as well. So I'm going to stop the share so I can see all of you. So yeah, if anyone has specific questions or comments that you want to raise as you've been a caregiver.
Yeah, Christina, thank you so much. There's a couple of things, Christina, when you were
Yes.
just talking, the idea, I think, so important for navigating end of life or just any stressful situation. But I find that I'm reminded of this most often when I'm in the position of being a caregiver, is this that our human brain can hold two extraordinarily opposite ideas and hopes at the same exact time. So I see this a lot of time at end of life when people, of course, are hoping that they're going to be the miracle and stay alive forever, but they are also holding in their mind and heart that they're in the process of dying. And for caregivers, this idea that there's nowhere else you would rather be than with the person you love and care about, and helping them navigate their experience of illness or death. And at the same time, I would rather be anywhere else in the world than right here, this moment. And that we can walk through. I think it's exhausting when people feel like those two things can't coexist, that it has to be one or the other. And it can be exhausting trying to make that choice. And just that we can hold the space, a big enough space for both of those things to be true at any given time. I think that was such an important reminder. And that we are the caregivers, the person, our job is not to heal that person. That is, whatever's happening for them is really in their own purview, that we're there to witness that. And then, of course, to provide the practical things that are needed to the point that they'll allow it. So there were times in the last couple of months where there were a lot of things like looking down the road a bit. I could see that we're going to need a couple of paid caregivers. We're going to need this. But that person was not looking down the road. They were just in that moment that day. So it stressed them out to no end when I started talking about, paid caregivers and indicating that we need more care. So trying to balance all of those things can be just exhausting. I want to also say that Megan, who is here, who I personally know also, posted, we talked about this, or looking for some supports for a caregiving situation she finds herself in, and dealing possibly with dementia, maybe not. And so she's posted this in the chat, the Association for Frontotemporal Degeneration, which is not Alzheimer's, but it was what it looks like on the website, what most people under 60 that think they have Alzheimer's may actually be navigating. And so for anybody, I'll try to put this information down in the resources that will be sent out afterwards.
And definitely once you have a diagnosis, if you do, because sometimes just that's the challenge of caregiving, is to get an actual diagnosis of what's going on with somebody, but really trying to connect with those disease-specific organizations. So whether it's an FTD association or Alzheimer's or Lewy body or a stroke association or Parkinson's association, those can be great resources of information, as well as they may be operating support groups themselves. So you can connect with other caregivers really in those specific diseases. So that's, I think, really helpful for people. Sometimes you're caring for someone who just has multiple chronic health conditions, and so it's not one specific. And so a more general kind of caregiver support group or information would be helpful. But if you do have a particular diagnosis, I would really encourage you to reach out to that disease-specific organization. I did put in the chat, given how many people are joining us from elsewhere, Elder Care Locator, their website and their phone number. That's how you can identify your local area agency on aging. And again, that's a way to get connected to other caregiver support programs or get referrals to specific home care agencies. They're going to be able to provide those very targeted referrals depending on where you live.
And for anybody that would like to ask a question, feel free to click their resource or reactions key and find the hand raising, and or here's something that somebody posted that I think is often where we find ourselves as a healthier person, working with somebody or being with somebody who's going through healthcare challenges, is that they feel that they do not need caregiving assistance or support. And then the people around them try to offer that, which they take either as it's insulting or they don't need this. And that question made me I just kind of smiled. I remember taking my first windsurfing course, and we were instructed in this way. If you were on the water and somebody, a boat or another windsurfer or somebody else stops and says, "Can I help you?" Your answer is yes, whether you think you need help or not, because sometimes people can see things you cannot. And within probably a month of that, I was out windsurfing one day and I was having a lot of trouble. I was moving further and further away from the shore. The sail wasn't up. I could, very exhausted. And a boat came by and said, "Excuse me, do you need some help?" And I said, "No, everything's fine here. No, don't look, nothing to look at here. We're all good. Just goodbye, goodbye." And then I continued to struggle for another 5 minutes. And then the voice of the instructor came and I was like, "Oh my God." And that boat circled back about 5 minutes later and they asked again. I said, "Yes, thank you so much. I need help." So they had to haul me into their boat and they were all in their sailing red jackets. And the lady looks at me, one of the ladies on the boat, she said, "This is fantastic. We were just in a class on safety and rescues and now we get to rescue someone like right away. This is fantastic." And I said, "Well, it was much better than the class I just had." But I say that like it's kind of a funny story, but what I've learned from that class is people ask me, my standard thing is, "No, I'm fine. I'm a caregiver. I caregive. I'm fine. No, it's okay."
Mhm.
And from windsurfing, I have learned that if somebody asks me, offers help, I say, "Yes, thank you very much. Why do you think I need that help?" And that gives them a chance to explain what they're seeing. And I'm much less reluctant to keep pushing it all away. Because the other thing that I have come to believe in the years that I was a caregiver for people, I do this work because I cared for many people before they died. And um, I think one of the biggest challenges, particularly for caregiving types of people, is accepting support themselves. And what I have discovered being a caregiver is the gift of allowing somebody close by when you're going through, especially dying. My first friend that allowed that changed my life, and I would thank him on a daily basis for allowing me to support him through that experience. And it was during the AIDS epidemic. It was horrible. Like what was going on in those days was horrible for people dying of AIDS. But people would come in and say, "Oh, you're so lucky to have Susan right there." And I was like, "You have no idea how lucky I am to be able to, number one, witness what death can be like, to support somebody I love, to still have a normal, like we would fight, we'd be in the hospital fighting with each other and the nurses come in and be like, "Oh, are you sure?" But it was beautiful. And it really gave me so much. I feel like those experiences early on gave me a lot of courage around my own death and what could I navigate and what I don't think I could navigate. And so being a caregiver is, I think, still the most extraordinarily difficult job that most of us will ever have. And knowing about these resources is just such a gift. So Christine, I'm just so grateful to you. And
And I just want to ask Susan, I mean, I think your story is kind of the perfect analogy for it. On two sides, one is, yes, that we don't always recognize when we need help. And so somebody who you're looking at, who you might think they need a caregiver, I need to step in and help them, and they're not allowing it, they may not see it and recognize it. And I think that's one issue. And I have a couple thoughts I want to add, but I think for you as a caregiver, if people do step in and say, "Do you need help? Is there anything I can do?" Learn to say yes, learn to respond with "yes, you can." And ideally, here are some of the things that would be helpful for me. And sometimes people are worried about, I don't want to be a burden. I don't want to be a burden on the people in my life by asking for help or even responding yes if they ask about it. And I think what Susan's story also highlighted is for the people who were doing the rescuing, for them to be able to say, "We just learned about this and now I got to practice it." There is value for the people who might provide help. So when you allow that person to help you and support you as a caregiver, you are helping them feel good about themselves, practice kind of those skills of compassion and empathy, and to be that support, to feel like, look, I'm doing something as well. So it's something that benefits the helper as well as you as that individual. And for, kind of, if there's somebody in your life you see who needs more care and they're resistant to your kind of caregiving help, sometimes there are ways to have those conversations. They are not easy to do, but to be able to say, "This is what I'm seeing," and to be very concrete about it. I've noticed you maybe lost a lot of weight, or it seems like it's harder to do as much around the house anymore. And then to step back and listen and give them a chance to say whether they agree or not with what your assessment is. This is where bringing in medical providers, having the doctor kind of say whether they think there's more help needed, because sometimes people are not going to listen to you as the family or even the friend, because what do you know? You're just my kid, you're just my friend, you're just my spouse, you don't know anything. So they may not listen to you in the same way that they would listen to a professional. So you may need to kind of pull in those other people to suggest where help is needed, and they might listen to that person in the way that they won't listen to you. So kind of bring in your allies who can support you with that. And especially that's true if somebody has some dementia or some cognitive impairment. It's a whole other layer of somebody not necessarily understanding why they are not able to be as independent as they used to be. And so much of this comes down to our kind of stigma on being dependent, that nope, we need to be independent, we should be able to do it all ourselves. And it's like, well, that doesn't tend to work so well. So allowing help and letting somebody else know if you feel like they need more help than they're allowing from you, that that's not a burden and you want to support them. And it actually will help you because you won't worry as much. Sometimes that's kind of our way in to somebody allowing a little bit more help from us. Any other questions or comments from people?
And I would say if it's too difficult to use the reaction key and you would just like to share something, if you unmute yourself, then you usually will float to the top of the list and I'll be able to see if you would like to share anything, a success you've had as a caregiver, a challenge that you wish you had more supports for, situation you found yourself in as a caregiver, or a situation you're dreading to be in that you might want to get some support in about now. A very quiet group.
Yeah. And if people have used caregiver support groups, or if there's a resource you've used that you found really helpful, that's also a great thing to share, I think, with others.
We have somebody that's unmuted. So Barbara, I'm going to get right back to you. That just reminded me when I was in a caregiver support group, which I cannot recommend enough for people to be. It took I went to help a friend of mine that needed to go to a caregiver support group, but my friends were dying in the AIDS epidemic like all the time, but I didn't think I needed any help. So I went to the caregiver support group where I was for 6.5 years. And most people were like 6 months or 7 months. So I was always the anomaly. But one day we were coming out of our group, and it was always a very tearful experience for us. And the group below us that with the life-threatened people were coming out the door at the same time. And many of them were the people that we were caring for from our group. And they looked up, one of the guys is like, "Oh, here comes the boohoo group again." And I was like, "What do you mean?" And he goes, "Oh, we call your group the boohoo group because you guys who are taking care of us just go upstairs and cry every week. You're trying to take care of our lives and your lives and doing all this. We're just trying to like get through the next day. So we're just kind of focused on the moment. You're focused on all of this." And I thought that was true. And also just so funny, like that the caregivers are trying to focus on that person, usually on the family, on their own needs, like this huge thing. And the person that's ill is just trying to get through the day. And that was just really helpful for me to have that lens to look. Barbara, did you want to? Where is Barbara? She is not here now.
Oh.
Perhaps she'll be back. No, maybe not. Anybody else want to unmute and just share anything before we close this afternoon? Christina, you have answered all the caregiving questions. It's amazing. Thank you so much. And thank you all for coming. I imagine that everybody that is here with us today is navigating some sorts of ideas around caregiving, or have been caregiving, or are going to be caregiving. And so I just am so grateful to you, Christina, and our long relationship with the Family Caregiver Alliance, and just how helpful that relationship has been to our patients and to the people in our community. And from everybody at Mission Hospice, we continue to be grateful for the Take Charge programs that you were Family Caregiver Alliance. Actually, for anybody who's seen our film, the Take Charge video that's on our website, It was funded by the Family Caregiver Alliance, so we are incredibly grateful for their support on that. And we'll be sending out an eval, and it was very helpful to me in particular if you're able to evaluate the program you heard today, and then we'll also send with that a set of resources. This is being recorded, and so we will also go ahead and put the recording up next week, and I'll email you in advance of that happening. And I thank you. There's some really positive things in the chat, Christina, and I'm also going to just take a moment, if we're going to formally close, Christina, by me thanking you, and I am going to also end the recording now, so anybody who is a little bit shy will be able to just join us and unmute. So we're going to stop the recording. Thank you all so much, and we look forward to seeing you again at another Mission Hospice community education event. Thank you all.